Mrs. Jones. My name's Jessica, and I'm going to be doing your postpartum assessment here today. I'll be taking care of you. So I'm just going to go ahead and wash my hands. Are you having any pain today? All right, can you rate that on a scale of 1 to 10 for me? All right, perfect. So I'm just going to go ahead and start with your vital signs. Check your temperature here. Okay. And I'm going to check your blood pressure. All right, now just check that. Everything looks good there. Next, I'm going to be listening to your breath sounds here. So every time you feel my stethoscope move, I just want you to take a deep breath for me. Good. All right, I'm just going to be listening to your heart sounds here, so you can just relax. All right, then I'm going to be listening to your bowel sounds. I'm just going to pull up your gown here a little bit. Just making sure these are active. All right. So next I'm going to be using an acronym called Bubble He to check and do this postpartum assessment here. So have you been noticing any pain in your breasts at all? Any cracking, anything like that? Okay. I'm just going to go ahead and look and just make sure those are looking okay. All right. So they're soft. I'm not noticing any lumps. She's not claiming any pain at all, and I'm not seeing any cracking or anything like that. Next, I'm going to just be moving here down to your uterus and checking that out. So I'm going to use the two-handed technique and just feel here and then feel for the top of the fundus, or the top of the uterus, which is called the fundus. And it's about 2 centimeters down from the navel. It's firm, and then if you just want to feel, this is what it should feel like. So if it's starting to feel a little bit different, make sure that you're contacting your physician as well. But everything looks good there. Just a few teaching points about that is that you can actually do your own massage, your uterine massage, and that's going to help contract the uterus and help to kind of stop that bleeding a little bit more. And then if you're noticing in your pad that it's becoming very, very bloody, and it's more bloody than it has been in the past, make sure you contact your physician just to check to make sure that you're not just having any more bleeding than what you should be having. Along with that, if you're noticing that you're in your pad that it's going from maybe yellowish and it's going back to red, it's possible that you are just doing too much and you need to get a little bit more rest. So just make sure you're checking on that. Along with the uterus, it is also midline, so that's good too. Next thing, we're checking her pad. We do this in 1 hour increments. So I'm just going to look at this. And when was the last time you changed your pad? About an hour ago. Okay, that's great. So it's about a moderate amount. I'm not noticing any clots. It's red, rubra, and I'm not noticing any odor coming from it. So that's good too. So have you been having any pain when you're urinating at all? Okay, so it's very important when you are urinating. You used to have a baby sitting on that bladder, so there was a little bit more sensitivity. But now that there's no baby there, the bladder just feels like it can expand to this really large amount, but you really don't want it to. So making sure that you're going to the bathroom every 2 hours is going to be really helpful for you, just so that you're making sure that you're emptying your bladder, because obviously a full bladder can lead to some problems too. Are you passing any gas? Have you had a bowel movement at all? Okay, so just kind of check in there. Next, I'm just going to flip you over here, and we're going to look at your episiotomy, which is just the cut that the doctor made so that you didn't cut on your own. So I'm just going to put on another pair of gloves for this, since I'm going to be looking down here. So I'm already looking at her epidural site. I don't see any edema. I don't see any redness. So that looks good. So for her episiotomy down here, I'm going to be using Rita, which is just a way that we look at wounds. So I don't see any redness, edema. There's no ecchymosis, no discharge, and all the wound edges are approximated. I don't see any redness or signs of any kind of STDs here, and I don't see any hemorrhoids either. So everything looks good there. Flip you back over here. Cover you up. All right. So next I'm going to be looking at your legs, and I'm going to be doing what's called Homan's sign. And this is just a way to check for blood clots in your legs. And at the same time, we're going to be checking for clonus as well. So what I'm going to do is just hold her leg up, and then just to make sure she's relaxed. And then I'm just going to kind of bring her foot back up. And if she had a lot of pain with that, that could be a sign of blood clots in her legs. And I'm just going to do the same thing on the other side. And then if it kind of had a weird recoil coming back, that could be a sign of clonus as well. All right. And then throughout the whole process, Mom was talkative. She was talking to baby. She didn't seem teary or overly emotional, anything like that. So that's good. If she would have had any type of cesarean section, we would be using Rita as well to check that wound site to make sure that there wasn't any problem with that. If she had had a Foley, or if she still had a Foley, we would be continuing Foley care and getting that out as soon as we possibly could. And other than that, do you have any questions for me at all? Okay.